Good afternoon. I am Jill Wiedemann-West. I'm the CEO of People Incorporated, and it is with great pleasure that I welcome you today to be a part of this wonderful occasion where People Incorporated will be adding its newest program to its treatment and care continuum here at Chicago Avenue. Today marks a significant journey that we've been on for years in Minnesota and continue to be on, which is to bring mental health resources and mental wellness to our communities to create community wellness overall. We are delighted to have all of you here to share in this important work with us and in this important day. This building represents not just a physical structure, and a lovely physical structure for sure, but a symbol of progress, of innovation, and of the collective efforts of many individuals who have dedicated time and energy to make this vision a reality. Certainly I would be remiss in not acknowledging our partners who started this program some time ago at Hennepin Health and found a way to work with us and partner with us to create a space where People Incorporated could come in and take the reins. Really very appreciative of their vision and their continued partnership with us. Thanks. Thank you. We got a win all of a sudden. Also, I want to be very grateful as well to our team here at People Incorporated, technology, clinical services, facilities, who got us ready to be able to take clients and open up this beautiful healing environment for the community. The ribbon cutting ceremony is not just about inaugurating a building. It's about celebrating the spirit of community and the promise of what the future holds, promise of hope. In partnership with Hennepin Healthcare, People Incorporated is proud to expand its commitment to serve our community through additional community services supporting mental wellness. Our commitment to communities in need is something People Incorporated and Hennepin Healthcare share. So to come together today and bring this building forward for the care of the community seems like a wonderful and extraordinary partnership. The new hybrid crisis and intensive residential treatment program that we see here offers 13 single occupancy rooms with a private bathroom, including 2 rooms designed for individuals who have specific mobility concerns, 1 on each floor, plus an elevator that allows us to work with individuals who are in need of treatment services or crisis services, but in fact have mobility challenges that oftentimes leave them without an opportunity to get the care they deserve in other places. Offering residential programs that are trauma-informed, mobility accessible, is something People Incorporated is incredibly passionate about, and something that we continue to be passionate about into the future as we look at all the different ways that we can assure trauma-informed environments, mobility access, and general access to mental health services in our community. We began offering hybrid model of crisis and IRTs under one roof with the opening of our Steiner Kelting mental wellness program in Chaska in 2021, allowing clients to transition from crisis to IRTs without having to pack up and move to another location temporarily or permanently. That also helped to reduce the anxiety of needing to tell your story another time, of needing to perhaps wait for that placement, and also just the anxiety that comes with, I know this environment, I know my care team, I'm comfortable and safe here, I like it here. So when that happens, letting our clients have the opportunity to be able to make that transition in the same program. Clients can maintain the stability that they need to continue their recovery journey with the treatment services, and we have implemented the hybrid model in also our Diane Aaron's crisis residence in St. Paul, Nancy Page residents in Minneapolis, and now Steiner Kelting, and of course, Chicago. People Incorporated looks forward to partnering with the Powderhorn Park Neighborhood Association, the Central Area Neighborhood Development Association, Hennepin Healthcare, Hennepin County, Minnesota Department of Human Services, and most importantly, the members of this community. It is my honor and privilege to introduce an individual dedicated to improving Minnesotans' lives through exceptional leadership and unwavering commitment to human services. Governor Tim Walz named Jody Harpstead the Minnesota Department of Human Services Commissioner in August of 2019. Before her appointment, Commissioner Harpstead was the President and CEO of Lutheran Social Services since 2011. She was also the Executive Vice President and Chief Operating Officer for Lutheran Social Services and spent 23 years in various positions with Medtronic. Commissioner Harpstead has volunteered in leadership capacities for various organizations, including Augsburg, Lutheran Social Services, ARM, the statewide Association for Community-Based Services for Individuals Living with Disability. This is a gigantic partnership, what we do in Minnesota. What we do is we come together and we find ways, we fill gaps, and we create space to do better and more for communities, for community wellness. If we're well, we're all well. And if we have access to the things that we need, we all have the potential for that journey forward. Commissioner Harpstead has long been a champion for welfare of our state's residents, with a wealth of experience, a deep understanding of the complex challenges faced by our communities, and an unyielding passion for making a difference. Commissioner Harpstead has worked tirelessly to ensure that the Minnesota Department of Human Services is at the forefront of providing essential support, services, and resources to those who need it most. And I can tell you, from having folks that I work with all over the United States, we have something special in Minnesota. We do something really special and really well in Minnesota, and I'm really proud to be a part of that. Through dedication to improving the well-being of vulnerable populations, fostering stronger communities, and promoting a better future for all Minnesotans, we are truly fortunate and grateful for the leadership of Commissioner Harpstead. As we come together to celebrate this new facility and the opportunities it will bring to our community, let us take a moment to express our gratitude to the Commissioner for their contributions to the betterment of our great state and for creating a pathway to mental wellness and community wellness that is unparalleled. Commissioner Harpstead.
Thank you, Jill. I am so honored to be here today. I told someone anytime I can participate in the opening of additional mental health capacity, I'm in. So thank you so much. The mental health and well-being of Minnesotans is a top priority for Governor Tim Walz, Lieutenant Governor Peggy Flanagan, and those of us at the Minnesota Department of Human Services. All Minnesotans deserve safety, stability, and access to care that meets their needs. Mental health matters at every stage of life and requires a continuum of services ranging from prevention to recovery. Minnesota and its many partners are responsible for ensuring that people who need mental health services get them, and promptly. Unfortunately, as we've all heard and read and seen, the number of Minnesotans experiencing mental health issues has been increasing in recent years. It's estimated that 26% of adults and 40% of adolescents have experienced a mental health issue in the past 12 months. Blessings to whatever's going on there. And this, while many have run into barriers trying to access care. As we come out of the pandemic, we've also seen a decrease in availability of care. There's been a lot of discussion in the last 2 years about the rising behavioral health needs of youth, and deservedly so. There's been progress. My goodness. There's been progress. I was just at a ribbon cutting for a youth residential facility last week. Yay, what a blessed 2 weeks. But the situation still remains a crisis. It's important to remember that behavioral health access is an issue affecting Minnesotans of all ages. We must ensure that adults and youth alike get the help they need and when they need it. Ultimately, we need more varied levels of care, and we need more beds for people who require a more intensive level of care. Today's ribbon cutting represents important progress toward those goals. It means more Minnesotans who need step-down care after leaving a hospital or need a higher level of care but don't require hospitalization will get the care they deserve. I love the hybrid model here, where people can start in one level of care and move to the other by walking across the hall. The facility that People Incorporated is opening is an intensive residential treatment services facility. We call it IRTS in Minnesota speak, which provides a community-based, medically monitored level of care for adults. These facilities use established rehabilitative principles and evidence-based practices to promote a person's recovery. They work to help the person achieve psychiatric stability, personal and emotional adjustment, self-sufficiency, and other skills that help them transition to more independent settings. DHS oversees these facilities, which have qualified mental health staff on site 24 hours a day and provide a safe and supervised environment in a community-based residential setting. These intensive services may be needed following a hospital stay or to prevent hospitalization. The stays at these facilities are usually less than 90 days, allowing individuals time to develop skills needed for successful transition to outpatient services and supports in their home communities. This includes individualized assessment and treatment planning, health management and recovery skills, assessment and services for co-occurring substance use disorders, family education opportunities, crisis assistance, development of healthcare directives and crisis prevention plans, nursing services, including medication education, living skills development, and assistance with a transition to community-based services and housing. Individuals who participate in these services share how developing care, trusting relationships with staff is crucial to their recovery. They also note that safety and comfort, both from the physical safety and the predictability of access to getting their basic needs met, promotes their recovery. Participants are often able to stay in touch with friends, family, and other professionals during their treatment, providing them with a sense of belonging in the community, which also gives them a chance to practice various skills they might be working on. I've also been talking to the team here about their pathways approach to hiring new staff and helping people develop cohorts of new employees that hang together and talk about how things are going and learn the skills they need to work in these settings together. Minnesota currently has over 50 intensive residential treatment services programs statewide. We're excited to add this People Incorporated facility to that list. I also recognize the significance of where we are today, just a block from George Floyd Square, and the community that this new facility is likely to serve. George Floyd Square has become a symbol of resilience and solidarity, where we have united to demand justice and equality for all. However, we can't ignore the fact that many community members are silently struggling with mental health challenges, often compounded by the trauma and stress associated with the events that unfolded at George Floyd Square. The COVID-19 pandemic and the murder of George Floyd shined a much-needed light on racial and ethnic disparities in access to behavioral health care. We know that Black, Hispanic, and American Indian communities have substantially lower access to mental health and substance use treatment services than other populations. They're also more likely to end treatment prematurely because they experience less culturally responsive care. Let me be clear, racism, not race, is a critical risk factor for mental health concerns and poorer outcomes. Minnesota's been at the center of a nationwide conversation about social justice and equity, but we must never forget the equally pressing issue of mental health for Black, Indigenous, people of color. People Incorporated opening a mental health facility in this community is significant for so many reasons. It addresses trauma and fosters community healing. The traumatic events that occurred here have left a lasting impact on the mental well-being of residents. It reduces stigma. Establishing a mental health facility in this community sends a powerful message that mental health matters, and we can talk about it. It increases local access to care. Individuals from here can get services here and will continue to be connected to their community while getting the help they need. We're thankful to People Incorporated for choosing this location to open this facility. We know you'll continue to make a profound difference in the lives of those who call this community home. While we're excited to celebrate this facility that People Incorporated is opening, we know there's still much work to be done across the state. Minnesota and many other states currently have a shortage of the highly trained, highly skilled behavioral health professionals who can provide the level of care and treatment that many need. Minnesota's begun directing resources to this effort, but we still need to look at ways to build out the workforce and recruit more people. At the end of the day, increasing access and improving access to mental health care will require resources. That's why this spring the Minnesota legislature invested $200 million to help bolster Minnesota's behavioral health system. These new investments in mental health and substance use disorder services, combined with significant steps forward in housing, health care, education, and economic supports, will move Minnesota toward a more comprehensive and forward-looking public health approach to behavioral health care. With this funding, support for youth and adult mental health care will increase, with stronger mobile crisis services, step-down options for people leaving hospitals and psychiatric facilities, and decades overdue rate increases and inflationary adjustments for mental health services. This funding will also result in more beds and more support for behavioral health care providers. For instance, a rate increase for adult day treatment programs and mental health community services will result in more people having supportive step-down options when leaving residential psychiatric settings. Adult day treatment rates will increase by 50%, while rates for many community mental health services will go up at least 3%. Rates have annual updates to keep pace with rising costs. Several cost-based services will also receive annual adjustments, including intensive residential treatment services like the one we're celebrating today, psychiatric residential treatment facilities, intensive non-residential mental health services, residential crisis services, and assertive community treatment. Culture and ethnic minority infrastructure grants will help recruit and retain behavioral health professionals offering culturally responsive services to Black, Brown, and Indigenous communities. And new grants will help more providers recruit staff in rural areas and underserved communities. DHS is dedicated to supporting everyone who experiences mental illness in their personal journey toward recovery, as well as preventing mental illness whenever possible. We are also dedicated to prioritizing work that expands community-based mental health services designed for prevention and early intervention. Thank you again to Jill and all the people of People Incorporated for stepping up to fill this important community need. Your compassion for the people you serve, your dedication to people who are struggling makes you a terrific asset for this neighborhood and surrounding communities. We're excited to continue working with you and all of our partners to build a more effective continuum of care for all Minnesotans with behavioral health needs. Together, we can build a behavioral health system where individual choice is respected, where people with mental illness are able to live, learn, work, and enjoy life in their community to the best of their abilities. Thank you so much.
You know, People Incorporated is a magical place. I really would say that although I've been in the nonprofit sector most of my career, I had never been at the community level until I came to People Incorporated. And it's truly a magical place where you see hope and change occur on the daily. And I just want to call out real quickly all these folks that are standing kind of behind us. Some of you might not be people, but many of you are People Incorporated folks that I just can't say enough about the passion, the commitment, the commitment that comes with working at the community level and creating wonderful, safe spaces. And I really want to, you kind of doing it to yourself, but I just want you to give yourself a hand because honestly, it's hard work and it's amazing work. And I'm very proud of all of you. You know, at People Incorporated, we say mental health is community health. And it's never been more true than it's been in the last few years. We've seen unprecedented challenges and changes in our society at so many different levels. And we realized, even for those of us who weren't sure that we really had mental health, we realized we all have mental health. We might be in different places, but we all have mental health. And what we are really building here in the community is an acknowledgement that we do all have mental health. And the more we can create space and access for individuals to get their needs met, the more likely we are to be able to move forward as individuals, as community members, as communities. And I'm very grateful that we are a part of that scenario. As we wait for Mayor Jacob Fry to show up and make a few comments about this as well, I thought that it would be a wise opportunity to open this to questions. If anyone has questions about this facility, about what we're trying to accomplish in Minnesota as it relates to creating community wellness and improved mental health resources. And so I would invite anyone that has any questions. This would be a great time. And we'll talk really slow as we wait for the mayor. Really, really slow. Yes.
Can you touch more on just the need for this hybrid model, kind of what we have right now in Minnesota, and what this is going to?
Well, the question was talking a little bit more about this hybrid model and what it accomplishes and how it's different than or the same as what we've already built here in Minnesota. I would encourage Commissioner Harpstead to come back up and fill in the gaps. But let me say, first of all, that one of the most exciting and extraordinary things about Minnesota, truly, is the way that we've led the way in crisis mental health care. And I'm not talking about crisis mental health care just in hospitals or emergency rooms. I'm talking about that community level. Diane Ahrens, our initial, it's now in a different location, but our initial program on Hewitt in St. Paul was one of the first crisis, I think it was the first crisis program in Minnesota. And it's really, it's a really extraordinary thing when you think about someone acknowledging that they are in crisis and that they need help, but feeling as though they have other options besides hospitalization if they're not sure that that's what they really need. And to be able to go to an environment that feels home-like, an environment that feels safe but also does not have any restrictions for walking outside and enjoying green space or taking a walk up and down the block, is an incredibly healing and safe way for us to work with individuals in crisis. We built the crisis system, and we built, to Commissioner Harpstead's comments earlier, the treatment system, knowing that they complement each other, right? Some portion of individuals that are in need of crisis services are also going to need some level of treatment services. So this isn't working as we're saying.
That's just for
So they're complementary. Individuals need to build tools. They need to build their tool belt. They need to understand how to manage symptoms. They need to learn how to manage anxieties and things that affect them as they're just moving through their daily life. And this is a great opportunity to combine the two of them and say, you know what? We can do both here. And we can watch you move through your crisis and then move forward as well with whatever you need to be able to live confidently and safely in your community. Do you want to say something about that?
You've all heard about the crisis in our hospitals, and the issue of hospital decompression and having people stuck or boarding, especially kids in some of our hospitals. And over the last several years, as that's occurred more and more and become more acute, lots of different things have been tried. Some different services in the community will say, well, we'll take someone, and they do, and they're not fully equipped, and the next thing you know, they're back at the hospital. And then someone else gives it a try, and it works for a few days, and then it doesn't, and they're back at the hospital. What I love about the People Incorporated model, the hybrid model here, taking someone who needs a crisis bed served by people who understand how to deal with crisis, and then perhaps they're eligible for their intensive regional services, rehabilitative services here as well. And if not, People Incorporated has other services that they might be eligible for. And so trying to help someone step down from their crisis of being stuck in a hospital, sometimes for a year. They're going to have to learn to manage their own behaviors. They're going to have to settle into a new equilibrium. And if they can start in a crisis center like this and then move to the next step and the next step and the next step, they're much more likely to be able to stay in the community and not go back to the hospital. So I love how our service continuum is beginning to fill in with these new services and these hybrid services and all these options that people are trying to help people slowly move their way into the least restrictive setting that they're able to live in. So it's a wonderful addition to our whole continuum.
We have to stay curious. We have to stay thinking about what's next, what's left in those gaps. Do we have any other questions?
Well, I have a question about, I've contacted Governor Hall's office, and nobody seems to know what's happening to the forensic navigators. He was going to get a committee. My grandson happens to be a person who was in Sheridan County and put a gun on the street with an incompetence trial, and it's gone through. He's paranoid schizophrenic, but each time he's out, there's just put on the street. There's no. This forensic navigator doesn't seem to be happening right or implemented.
I'm afraid that's not my area of expertise, but I appreciate your question. Let me see if I can get your information afterward, and we'll see if we can follow up and get you on.
Edelson created the law,
Yeah.
and then there was another law so they could fund it, and then the next step is this. That's what her recommendation is, forensic navigators,
Okay.
to see people out from the jail, where the jails are going. He's lived 4 months in jail, too,
Yeah. Right. Got it.
rather than a hospital.
Let me get your information after and see if we can follow up and get you where
Thank
your
you.
son needs. Thank you.
So I would ask this of the commissioner, actually. I mean, so this facility has 13 beds, and we know that's a drop in the bucket from the need. How do we bridge the gap, even with $200 million invested in these services, to make sure that we don't have people who are dealing with mental illness or dealing with dealing with like other sort of issues, living on the street.
Yep. Some of the things we've been doing in the background for the last several months is in our aging disability services. We've been looking at acute transitions as a whole area of our work now. We have a director of acute transitions. We didn't have that before. Now we do, because of what's happening in our communities. And they're bringing together experts. They're bringing together various funds in the state. We've had some funding in the Behavioral Health Division. We've had some funding in the Disabilities Division. We've had some new federal funding come in. Putting all that together to see what our department can do to help with the whole conversation about transitions and literally taking specific cases and helping people find what they need. Our direct care and treatment entire hospital system is looking at ways of opening capacity there for more people, and so they've had several ideas. The very simple one that's already been announced is the overtime closure of our care facility for substance use in Wilbur, which would help us fully staff the Children and Adolescent Behavioral Health Hospital. We're also adding staff in our other care facilities, so we're not decreasing substance use staff across the state. We're just moving them around. And then direct care and treatment services have all new ideas for next year, and so we're starting to step up first and see what we can do to add capacity in our services, and then add the staff in our policy areas to help decide what's next and how we can help various providers. We're currently having a conversation with a group of providers. I'm pleased to say People Incorporated this morning said they'd love to participate as we talk about moving some of the most acute patients out of the hospitals who've been stuck there now for some time, and who can take one and who can take one here and who can take one there, until we can get the system sort of flowing again after it landed in this sort of stuck place after the pandemic. So lots of things going on right now, a lot of community conversations, pulling together the funding we do have, adding the $200 million, and developing proposals for next session.
I have it on good authority that Mayor Fry's on his way, so we'll just keep this going for a couple more minutes. Commissioner Harpstead, thank you so much for the generosity of all of the information. This is, I think, actually really exciting that we get to have a little bit of a Q&A. Are there any other questions that anyone has? Great.
Will the crisis first model be utilizing peer support services?
As often and as easily as we can create peer support services in any of our programs, we want to make sure that those are accessible for our clients. Absolutely. Does everybody know what peer support services are? No. Great. You want to tell us what peer support services are?
Certainly.
Come on up here. This is a very, I think, a very interesting and important part of the Minnesota model. So, and I'll let Ray, who works in our training institute, is one of our trainers, is kind of an expert in this area. So I'll let him tell you real quickly what that is.
Thanks, Jill. The peer support model, which is part of SAMHSA's overarching definition of recovery, SAMHSA, the Substance Abuse and Mental Health Services Administration, includes peer support services, and they found that working with peer support services, and that is an individual with a lived experience who's reached a certain level of recovery, that they're able to be stable and then provide guidance, sort of like a mentor or a coach, but a professional friend in a clinical environment to help people stay involved and get the most out of their treatment. Statistics have shown that peer support specialists reduce cost and reduce hospitalizations and increase time between hospitalizations for those who have severe and persistent mental illness, where they may have annual hospitalizations, that being able to gain skills and practice them with the help of a peer support person who's kind of been there before and been through that has been able to really bolster engagement within the programs.
Thank you, Ray. I appreciate that you were standing right in my eye line, so I could say, "Gosh, let's get somebody up here." This is a really valuable tool in our toolbox, the peer support specialist, and it's something that Minnesota has been very, very focused on in terms of training and creating training pathways for peers in the state. So it's been great. Yeah.
Quick question, can you share a little bit about the ancillary wraparound services that we have in addition to crisis and intensive residential treatment services? I know we have portability here. I know there's some other things that we do to help support our clients.
Well, this might be another opportunity for either Dave or Wendy or someone to come up and talk about that. People get tired of looking at me, right? Good answer. Wendy Waddell is our COO at People Incorporated, and Gabe Becker-Finn is the director of our IRTS Crisis Services. So I'm going to let you guys briefly, because the mayor's on his way, but not too fast.
Can you hear me?
Yes. So complimentary
Jill
services.
obviously knows me well. So I'm lucky because I'm surrounded by directors of all of our different services at People Incorporated. We specifically have care management teams, Waiter, targeted case management teams, give me a mic and I mess up my words. We have assertive community treatment teams. We have artability and other complementary therapies. We have lots of children's mental health work going on with targeted case management, school-based therapists in 31 schools now, Sarah. We have outreach programs, embedded social workers in St. Paul Police Department as well as Roseville Police Department now. talking to another police department. We have our incredible HR team. I see all of them here. And our incredible finance teams. So we have all sorts of different ancillary partnerships and programs that we have across the Twin Cities. Outpatient clinics. I have to say, I'm seeing everybody in front of me to remind me here. But we have 20 types of programs in 26 physical locations across the Twin Cities, and now up in Duluth, we have a rapidly growing waiver case management team. So, Gabe's over 9 crisis arts facilities now. This will be the 9th one. So, did you want to add anything?
And I just want to make sure I remember. Can you repeat the question so I make sure I'm answering it correctly?
What's the question?
I was wondering about other ancillary services that help support our clients and help them transition to different levels of care.
Yeah. So I'll speak specifically about this facility and how we work. As Wendy was so great in saying, we have a lot of different services available to us just throughout the company, but also we have the larger community here to access. And so a big goal of ours within our treatment is we want our clients to access those resources. We want them out in the community. We want to see them participate and be a part of just the larger community and that we have. And so we do that in a couple of ways. One, we encourage people to get out of the facility, attend appointments, see, have family, your support network. But also, we like to bring in services from outside, and I really see this as kind of the entryway into a lot of the services that we have and help develop that into recovery. And so we bring in things like art ability to help with a different modality of treatment that we provide through art therapy. We have the ability, the ability to bring in arms workers to help learn additional living skills that they can take with them once they leave with us, but also be connected to a service that you can use after you're done with your time here. And just to name a couple of great options, but also we want to work on just connecting everyone to the services that they need, that they feel are valuable to them and their specific situation. So there's not a one-size-fits-all treatment here.
The staff working here also will be using evidence-based treatment modalities, different group curriculums. We also have the ability to bring in group curriculum that's related to occupational therapy, sensory integration work, and simply the space being wide open and private where it needs to be private just adds to the whole treatment.
Back to me. You did brilliantly, speaking very slow. We're really trying. We're really trying to keep you all, engaged here until Mayor Fry shows up. One of the things that I would, really expound on that a little bit is People Incorporated is been for many, many years a very big believer in the integrated model. And the integrated model, put simply, is surround the person with all of the different things that are going to help them to be successful. And in a more complex level, it is structures and conventions that ensure that that individual gets those touches, right? Minnesota has made a commitment to the integrated model through its demonstration as one of the initial states for demonstration of the SAMHSA model of the CCBHC, which really focuses on access and care and really looking at integrating the individual into all the things that are going to be there to make them most successful, and then of course driving better outcomes, driving better better experiences for the client and better outcomes once they are back in moving into their communities, or if they're already in their communities in a routine around their services. This is an important designation because you see that happening in programs all over People Incorporated, all over the state. This is an expansion area for the state, and the state is continuing to add more of these services all over. But more importantly, when you think about just Chicago, the People Incorporated Chicago Crisis Search Hybrid Facility, this is very important. It brings artwork into the environment. Why is artwork important? Sometimes folks that are in crisis, sometimes folks that have been struggling for a really long time, have a hard time articulating what's going on for them. But oftentimes, if you ask them to sit down and draw a picture or cut pieces of paper out of a magazine that articulates sort of where they're at, you have an extraordinary conversation that begins. And we're really proud of the fact that art is an essential part of our complementary therapies that we do in all of our facilities, as well as in the community through our open artability workshops. We look at, nursing and wellness, tobacco, all of the different areas that can become those essential integration areas to help that individual find all that they're going to need to actually really succeed in whatever way they define that success. So I just wanted to kind of add to what Wendy and Gabe said. And
Could you talk about what he's a crisis? What is a crisis? I told you I have a mentally ill grandson. We've had so many crises over 18 months, and nothing is a crisis. Nothing's.
So
what is a crisis?
Crisis facilities are described as someone who's in acute sort of psychiatric crisis. They are in need of a plan to kind of help them move forward out of that. Our crisis facilities are typically facilities that will be able to work with somebody for up to 10 days. It's intended to be a fit for an individual to basically come in, settle in, create a plan with their therapeutic team, and be able to move forward and in terms of deploying that plan once they're done. The reason that the treatment piece comes into it is, as we all know, sometimes 10 days is just the beginning. 10 days opens me up and says, I'm actually capable of seeing that I could really benefit from more treatment. I could really potentially benefit from doing something else. And at that point, then we refer them to their next steps, to their next stages. In some cases, if you're referring out of a program,
This is not a hospital is more of a crisis place. This is more of a housing. Is this correct?
Well, I'm going to invite the commissioner to talk about this a little bit with me as well, but hospital is different. These are all freestanding. There's no locks on the door. They are not secure. They are intended to be an environment that feels safe and comfortable, where an individual that's in crisis, now that individual may not be right for this facility based on what they're presenting with. They might need something more, or they might be perfectly right for it. I think to the point that was made earlier by Commissioner Harstead, it's a continuum. It's not intended to take the place of a hospital or an emergency room. It's not intended to be a state-operated sort of environment. It's another step in a continuum for individuals that are appropriate for the level of care.
Usually when we can get him to a hospital or to a place is when it's not threatening to cut himself in the car or hallucinate, The crisis, you can't do anything with these people in a crisis. It's pretty much...
Well, again, I think it depends on the definition of the crisis.
That's what
right?
I'm wondering what you...
Yeah, I mean, I think it depends on the definition of crisis. If you are in a situation where you potentially and imminently could harm yourself or others, then this is not the right place.
That's the crisis.
Yeah.
That's what I'm trying to define.
Thank you. Yes.
Second, can you hear me?
Mm-hmm.
Second on that, I was so impressed with the trauma-informed design of the house. From the minute that a patient walks in that door to have an initial intake meeting, to having a single bedroom, there was lots of little thoughtful decisions, albeit maybe not several rooms in this house, but each one was thoughtfully designed. Could you tell us more about how those trauma decisions
I'm going to bring Dave up and let him tell you all about it because he is the expert about these trauma-informed environments and why we do what we do. I'll help you if you really need help. But
All right. So the question is how we design the trauma-informed. Honestly, and I'll do a shout out to Dan Nordland, who will be the manager here. We both came into this facility, and the first thing we did was start walking around and having our heads on a swivel about all the ideas for how do we want treatment to be here? How can it be trauma-informed? We're really excited with the idea of having the individual bedrooms, looking at what is the best place for the clients themselves to have that intake, where they can feel like they have some privacy and the ability to be there. And so it's just a lot of little things. We spend a lot of time and have been in here a lot just looking at for all those little pieces, building on the know-how we have from our other 8 facilities that we have, and just years of experience of knowing, like, here's where we run into some issues beforehand. So being able to look at it and say, this would be a really great idea. Here's because we have this blank slate. So I think that is what drove a lot of the design piece of it, and just really keeping an eye on how we plan to actually use the space was very key.
So you're going to be a block from George Floyd Square here. I mean, what sort of outreach are you planning to the community there? There is a community that's based around there, and they do struggle with people who do have mental health issues. What sort of outreach are you planning, just so they know you're here?
you know, we've been doing so much outreach. Where is Abby and where's my communications team? They might have better stuff, but we have been working actually with the community for months. We actually just recently started doing our art workshops down in one of the spaces down here that are free to the community. We've been doing a lot of work with the neighborhood associations and groups, and really, you know, when we moved into this space, we were very clear that we needed permission to be a part of this community, and so we worked very hard from the get-go to talk about who we were, talk about what we do and what we don't do, and really get the permission from the community to be a part of their space and to be a part of the solutions. And Abby, do you want to say anything about, real quickly, about the work that we've done here in the community? That was the question. What we've done to kind of move into the community and okay.
Yeah, so before I came out, really listening that, you know, kind of asking the permission and going door to door and meeting the people in their homes. Just down the street here, they have, every day, they have a community kind of meeting in the morning that we have been involved in. Knocking on everyone's businesses and introducing ourselves. And really the big thing that they express to us is we don't just want another business coming in for profit just for themselves. So we're really making a point that we want to be part of their community and part of the solution to what is going on in this community. So we're just making sure that we answer their questions. We're here for an ear and just for another solution within the community, and not just another business coming in that they feel we're not welcome. So we have been really welcomed here. We've had some really great conversations, some really great meet and greets. We have started a youth art ability program here, so where we're very fortunate that they are welcoming and they express that they really do need this kind of help in the community. So we're very happy that we can provide that.
How do you spell your name, Abby?
Yep.
How do you spell your name?
A-B-B-Y.
And your last name?
York, Y-O-R-K.
Thank you.
Thank you.
Okay, well, the mayor is very delayed. And we have done everything we can, I think. And I did just talk with someone from his office who agreed that we've done a really good job of trying to create space for the mayor to arrive. So I really want to thank all of you for being here. The mayor will be coming at some point, so if you're still around, I'm sure that you'll have a wonderful opportunity to meet Mayor Jacob Fry. I want to thank Commissioner Harpstead for being with us, answering questions, being so flexible, and giving us so much of her, I know, very busy schedule, and being so generous with her time. We are going to do the ribbon cutting, and we are going to let you all go free.
1, 2, 3. Good.